marked it down below, but it
I'm
won't
looking on my list, so
pull it
sorry.
up again.
Okay, Dion Martinez,
I'm not seeing it. It just seems.
Diana, I don't think she's able to attend.
Brownwin Fees,
Here.
Hillary Christ,
There, I see it now.
Susan Bowles, Ann Elliott,
My,
Aaron
I
Schweiler,
can't, if I.
Schweiler,
If I
Monica
do that,
Ross?
then will they?
later, I think. Maritas Altoona,
Here online.
They're talking.
Senator Renee
They're saying it
Erickson.
needs to be picked up.
Representative Susan
All
Ruiz,
right, thank you.
Ruiz,
All right, bye.
Courtney Hockman. Jennifer King is our SEAC liaison.
I'm here online.
Kim Kennedy, ex officio, Kansas Department of Children and Families. And then Leslie Gerard, ex officio, Families Together. Did I get everyone, Stacy?
I'm here online.
Oh. Elizabeth, I think, Rasheen, Card. Thank you. Parent member. Tiffany Bartley. And that's all the names that I have. Did I miss anybody?
Awesome. Okay, thank you. Again, welcome everybody. We're gonna do, like I said, a couple more red tape items and then we will go into introductions. But so first off, we're looking at the agenda. I did have a request to add some strategic plan and committee reports from the SICC. I think we'll be able to maybe work that in about that 9:30 timeframe just between those two. So from SEAC members, I would entertain a motion to approve the agenda with that amendment. Autumn has made a motion to approve the agenda. Do I have a second? Lena has seconded that motion. I'm not, do we have a poll for that? Made a motion. Seconded that motion. Do we have a for that? Okay, there is a poll for that, in the room, all in favor, SEAC members, raise your right hand. It looks like that passed. I can kind of barely see. Passed. Okay. All right. The second item is to approve our minutes from November 20th. Those were sent out ahead of time. Are there any corrections or things that we need? Oh, that was already approved.
So I'm sharing my screen, but it's not.
Okay, those were both approved. Excellent. We are past the time for public comment. Is there anyone present or online that is here for public comment?
The people there are not seeing it, which they should be because I'm sharing the screen.
Okay, hearing none, we will get into some of the really fun stuff and exciting stuff today. We're gonna start with I'm sorry.
Happy, do we want to do our approvals on it?
Okay, before we get to the fun stuff, more red tape. Here we go.
So first up.
I did find one, so. Okay, so we'll need to approve the agenda as well. So I'd entertain a motion from the SICC. Susan Bowles moves and Elliot seconded. Any discussion? All those in favor of the motion say aye. Opposed, same sign. Motion carried. I'd entertain a motion for the minutes from the November 20th, 24 meeting. Courtney Hodgman moved to approve. Is there a second? And Elliot seconded. Any discussion? All those in favor of the motion say aye.
Aye.
Those opposed, same sign. Motion carried. As well, we would have public comment, but there wasn't, so, okay.
All right, now we get to get into some introductions. So again, welcome everyone that's here and online. So excited to have the opportunity to have this meeting. Want to start off with just some introductions, just so we kind of know who's all in the room and who is online. So we will attempt to pass a microphone as much as we can. And we will then go out to the people online, and if you'll just tell your name and kind of what your role or position is. I will start, and then we will move this. Oh, we have a second mic. Excellent. And we will move this around the room. So I am Lindsay Graff. I'm the Director of Special Education in Coffee County. This is my 24th year in education, and I can't believe I'm that old, but it happens. And this is my second year on SEAC, and I'm the chair this year. So.
I'm Lena Kisner, and I'm the Special Ed Director at the Reno County Education Co-op. I'm the chair-elect for SEAC. I fill the role of a Special Education Administrator on SEAC. And then I'm also the President of the Kansas Association of Special Ed Administrators.
And I'm Kathy Kirstenbrock-Osmeyer, Director of Special Ed at the Northwest Kansas Educational Service Center, and also the coordinator for our Early Childhood Coordinating Council, EC3, which is the Infant Toddler Services Program in Northwest Kansas. And chairperson of SICC.
Hello, good morning. My name is Jennifer Kaczynski. I am work with Kansas State School for the Deaf. And my role is I represent state agencies that provide related services.
And I'm Bert Moore. I'm the State Director of Special Education and Title Services, and this is my 14th year working with SEAC. I served back in the 90s and early 2000s, an 8-year term, and was chair at that time. And here I am back as State Director and being the Secretary of the organization, so that's me.
I'm Stacy Clark. I work for KSDE, and part of my role there is supporting the SICC.
My name is Alicia Nichols, and I'm one of the 2 assistants that work to support SEAC.
And I'm Erin Schuweiler, and I work at the Kansas School for the Deaf in the Sound Start Birth to 3 program. I also support the language assessment program, which serves children deaf and hard of hearing ages birth to 8. And I serve as a provider member on SICC.
Good morning, I'm Susan Bowles, speech language pathologist from Hayes, Kansas. Worked with birth through 5 for many years, I'm not gonna say how many. And then retired, but you know, we have a shortage, like those kind of therapists out there. So I'm out of retirement, working with KidLink, 7 counties, North Central Kansas, speech language pathologist, provider member for the SICC.
Hi, I'm Rebecca Bell. I am with KDADS. It's my 5th month, so I'm very new. I am here in place of Gary Hinault, so thank you very much.
I'm Ann Elliott. I'm the Executive Director of the Family Resource Center in Pittsburgh, Kansas. We're a child care preschool facility licensed for 362 kids at any given time. I am a provider member on the SICC.
Hi, I'm Autumn Bilks. I'm from Dodge City and I am on SEAC as an individual with a disability. This is my first year on SEAC and I work at a middle school as a special ed teacher, overseeing IEPs.
Hi, I'm Courtney Hockman. I am from Manhattan, Kansas, and I am a parent member of the SICC.
Good morning, I'm John Harding. I'm the superintendent of the Kansas State School for the Blind in Kansas City, Kansas, ex officio, I think, non-voting member of SEAC. So nice to be here.
Hello, my name is Shonda Gross, and I am with KDHE Healthcare Finance.
I'm Christy Wyckoff with the Children's Cabinet, and part of the SICC.
Good morning, I'm Leslie Gerard, and I'm ex officio member of SICC and SEAC, and I represent Families Together, the Parent Training Information Center for Kansas.
Hello, my name is Tricia Wagoner, and I'm the Part C coordinator for the state of Kansas, and I am KDHE's representative on the SICC.
Hello, I'm Lisa Collette, and I am the vice chair for SICC, and I represent the insurance commissioner for the Department of Insurance. And I'm also the family engagement coordinator for the Deafblind Project.
Good morning, I'm Braun Winfies. I'm Associate Dean and Professor at Kansas State University College of Health and Human Sciences and serve as the K-Board representative to SICC.
Hello, I'm Sydney Dringman. I am the Deputy Director of Permanency with DCF. So I represent the Child Welfare Agency and foster care on both the SICC and DF.
I am Rebecca Schultz. I am with SEAC as a volunteer or an adult with disability. I am also a retired special ed teacher.
Melissa Valenza, I'm a coordinator with KSDE and I'm a SICC member.
Good morning, everybody. My name is Brian Dempsey. I'm an assistant director on the Special Education and Title Services team with the Kansas State Department of Education.
And I'm Dean Zeitz, and I'm another assistant director on the Special Education and Title Services team with the Kansas State Department of Education.
Okay, and online, if you guys want to go ahead and introduce yourselves, you'll kind of have to take turns as systematically as you can.
Hi, I'm Jennifer Flores. I'm a special education teacher with Shawnee Mission School District. This is my 3rd year as a teacher and my 1st year on SEAC.
Good morning, everyone. I'm Dr. Brooke Moore. I'm a faculty member at Fort Hays State University. This is my 2nd year on SEAC as a representative of higher education institutions.
Good morning. This is Marita Saltuna. I am the Director of the Family, Infant, Toddler Services at the Kansas State School for the Blind. I'm serving as a provider member with SICC, and this is my 2nd year.
Good morning, I'm Whitney George. I'm a general education teacher in Manhattan, Kansas. This is my 4th year on SEAC, and I'm actually moving to special education teacher next year.
My name is Nichelle Adams, and I am the SICC DCF Child Care Representative, and I'm the CCDF Administrator for the state of Kansas. I'm a co-administrator.
Hi, I'm Jennifer King. I'm the early childhood coordinator for Wichita Public Schools, and I fulfill the role of the parent of a student with gifted services on SEAC. And I'm also the SEAC liaison on SICC.
Good morning. I'm Roxanne Zillinger. I'm a program consultant with Kansas State Department of Education, and I represent Homeless Children and Youth program on SEAC.
Morning, I'm Brandon Gay. I'm the program director for Colby Community College at Norton Correctional Facility. This is my 4th year on SEAC, and I represent corrections.
Hi, my name is Jennifer Kurth. I am a professor at the University of Kansas and department chair, Department of Special Education at the University of Kansas, and I represent higher education.
Again, and it didn't work. I'm Monica Ross. I am the program director for infant toddler services at Johnson County, which was one of the Part C networks. And I am a provider representative on the SICC. I'm sorry, I'm late.
Okay, we will go into the portion for the SICC to share your strategic plan and some committee reports and updates.
Yeah. I wonder.
Oh, I think Tricia says she's later. This is for that part we added today, so.
Oh, okay.
Who's giving the strategic report or strategic plan and the committee reports?
Okay, well, let me get there. That's okay. I'm doing it. We're just getting it pulled up. Okay. So what we'll do is what we're gonna do is talk about our strategic plan and the goals that we came up with last April while she's pulling up the PowerPoint. And then most of our work is done in our committees. So the committee chairs that are here will just share a bit about their goal and what the work is that they have been doing since we started in April. What did you name that? Okay, it looks like it's about to. Sorry, you know how every room has different technology needs, so thank you for bearing with us this morning. Is that it? Okay. I guess while I'm up here, I can do some other things. Like we have water over here by the door if you'd like a bottle of water. The restrooms are right through this door on the left over there. There are also some comfy chairs around the building, like if you need to step out and attend another meeting virtually or something like that. We do have a few snacks up here, some water, a few sodas. And I believe that I didn't have a cinnamon roll, but I believe they're warm little mini cinnamon rolls. If you haven't had a chance to have that, we have coffee up here too. And I think I see a hint of it. Well, there it is. That was weird. Okay.
I don't know what it is. It says I'm sharing it, but it's not. Oh no. I don't know why it's doing that. Look at the screen up there and move it to next. Well, I can do that from here. Actually, the bottom, she just needs to make it into presenters. It's called budget.
Yeah, I'm sharing. Okay, the next thing I can announce is, if I remember correctly, our lunch today is going to be chicken cordon bleu. I hope I'm remembering it correctly. I think I do remember maybe lemon bars and brownies. You can tell which part I remember.
Where is it? Where is that? It's right there. Oh, I see what you're saying. There you go. Now you can do it.
But now
It's a second screen.
okay. And go down to the link that was sent to the online interpreters. We have 2 interpreters that are online. Yeah, are they not? They're saying they're having issues. Okay. You have.
Give me your email.
Okay, okay. The new one.
It's the, is that?
It's, I sent it out.
The one you just sent out.
Yeah, it should say updated. Zoom. At this point, I just. Okay, I wasn't gonna read these to you because each of our goals, the committee person is going to talk about it. Let's see, we'll skip. Goal 1 is, so let me back up. So I'll give you an overarching thing of our goals. So goal 1, we have Medicaid, getting on working more Medicaid funding. We have goal 2 on categorical aid, goal 3 on inclusion, goal 4 is aligns and complements with the All In for Kansas Kids strategic plan. And then we have a systems and supports committee that just does all kinds of things for SICC and LICCs. And then we have a support for the LICC committee too. Okay, next, yeah, next one. Okay.
Hello. So, again, my name is Lisa Collette and I am the chair for the Medicaid group, funding group. So currently, so our previous goal, was research and review policies and strategies to maximize Medicaid reimbursement through Part C and Part B. However, as Stacy indicated, we're gonna review and utilize existing Medicaid research and data. And we've partnered with KU with their the CPPR as a stakeholder, and they're really the ones who are gonna be looking into this for us. And so we're gonna take that report and look it over and then go from there as far as what we feel like needs to be done for our state. And our hope is also to look at the Medicaid reimbursement codes that are out there and whether or not they're open to Part C as well, because if that's the case, then that would be a game changer for our Part C programs. So it's just gonna be an ongoing thing. There was a little bit of a halt in this research, but we're supposed to be meeting back up with KU sometime this month, maybe into February, to kind of see what's going on, to see what they've found so far. We've also provided them with some of our own research and documents that we found, from other states and what they've done in order to make sure that, there was money to help provide intervention services as well. Like for SLB, OT, things like that. For instance, New Mexico has done it to where their state legislature request their insurance departments or insurance companies to provide an amount of money into a pot that goes to help pay for some of these things. So I'll go ahead and stop rambling and give us back over to Stacy so the next group can present. If there's any questions, you guys can ask me.
There's two meetings, thanks.
Okay, and I think Cat A is next. But I think.
Monica, is that you? Monica didn't attend a meeting one time and she got nominated as the chair.
Let that be a lesson for you all. Yes, I'm Monica Ross, consequently the late one. But yes, I am the chair for the Categorical Aid Committee and Work Group. What we've really been talking about this year is primarily looking at the infant toddler programs, looking at the CAT aid that they are claiming, and then we're looking at the CAT aid that they're eligible for. We've spent a lot of time reviewing previous testimonies as well that have been presented when we've talked about Part C funding. But our biggest question is surrounding, are the Part C programs capturing all of the CAT aid that they're eligible for? We had a great meeting this month. Yeah, I think it was actually just last week. We had Evelyn and Dean come, really kind of explored what that piece looks like, how Part C program coordinators can get access to reports on who is in their program and what that looks like for the district level billing, and really just exploring that angle. So that's primarily what we're looking at right now.
Joyce, can you see which one's next, please?
Won't let me get up. There we go.
Approving committee is Chavez.
I don't think she's here. And at the last meeting, maybe I should let you talk. Chavez is not here, but I am on that committee, the SICC, the inclusion in Part C and Part B committee. And the goal is to assist and advise. She has KSDE and KDHE on early childhood LRE and inclusion practices. And then some of the strategies that we're looking at the committee, one of them is to really look at the federal and state guidelines so that our committee members really have a good understanding about what is LRE, what is natural environments, and how they can work together to improve transitions, identifying best practices to support inclusion, and then explore resources across agencies and organizations. So we're just getting started with that committee, and Chavez is really getting us organized. So that's wonderful. Do you want me to go ahead and do my committee while I'm here?
Yeah.
Okay. So I am the chair of the the local interagency coordinating council support committee. And that's kind of our goal. We're here to support the local interagency coordinating councils. And so some of the things that we are looking at is just ways to help those local interagency communicating interagency coordinating councils in having parent members, which is one of our the goals that our state and our local committees have. And then also, we do provide every year a training to support not only the providers with getting continuing education units, but also to look at the childcare providers and preschool teachers and try to provide an easy way to get access and learning. And we have a fall retreat every year. It is online. And we usually have two or three topics that we have. And we had our last one on November 1st, really well attended. They've been really well attended for the last couple of years. So we just keep doing them and it's great. So we are going to continue that. Right now we are looking at what topics we're going to have for our retreat, which is going to be next year on Friday, November 7th. And then, let's see. We do meet once a month on Thursday, remote meeting, very easy. So if anybody on the committee would like to join, you're more than welcome. We love all sorts of ideas. We meet on the second Thursday of the month, remotely, 3:45. Just let myself, Susan Bowles, or Stacy know. And we are moving. We've had our first meeting. We kind of took a little break after our last retreat. It's a lot of hard work. I do want to thank my committee members before I forget. Aaron Schuweiler, Christy Hockman, Courtney Hockman, I'm sorry, Courtney. Stacy's on that, Maritas, Liz, I have a wonderful one, was on it last year. Wonderful Anne. I know I'm gonna forget somebody, and I'm sorry if I did. Have a wonderful committee. They all work very hard to put that together. It's a lot of work, especially right before we have that retreat. And I do want to thank them for that. We are moving right ahead and we're getting very good at this. So that's wonderful. I want to thank you. And if you have any ways that you feel like the LICC support committee can help you, please let me know. Okay.
The next committee person for SICC systems and services is not here today, but they've been digging into the All In for Kansas Kids strategic plan and trying to hone in on what specific goal they're going to have for an action plan, and they're close to that one. That one? And that was it. Kathy, anything else?
Okay, next up, thank you for all that great information. It's great for us as in SEAC to know what all the stuff, hard work that you guys are putting in. That's awesome. Next up on the agenda, we have the SIC SPP API report with Tricia White.
Microphone, you want to use this one?
Yep. Flip it on.
Yep. Listen to directions. Then speak. Okay. Hold on just a second.
Yeah, now I can't. I think I'm gonna give up for the day.
Nah.
Okay, we saw it peeking.
Not allowed.
It's sharing here, but it's not up on the screen.
Okay.
It's sharing here. Okay, I'm turning to. And trying to share this. It's the power thing. And it's.
So everybody on the SICC should have gotten a copy of the state performance plan annual performance report yesterday. I finished writing indicator 11 this weekend. And so got it to you yesterday morning.
That should be.
Stacy has a list of the various indicators for Part C and Part B, if anybody needs a cheat sheet.
Okay. Okay, and then it's right here. But now you need to change the share back. Okay. Share.
So the SICC will need to approve this report before I can submit it to our federal partners. Just so you guys know, right after I sent in the report to everybody, I finally got feedback from federal TA on some of the stuff that needs adjusted in the report. Luckily, the only thing that really needed adjustment is the introduction, other than a couple of typos, which I've already corrected. So you know there will be slight adjustments to the language in the introduction. It won't be substantive. It'll just be clarifying language. But I wanted you all to know that those changes will be made before I hit submit to the feds at the end of this month.
Okay.
All right, here we go.
I don't want you to get that. Just say that. It's all about that. Okay.
So this report is actually for federal fiscal year 2023, which is state fiscal year 2024, which runs from July 1st, 2023 to June 30th, 2024.
So you just know what time period we're actually talking about here. All right, next slide, please. Already said that. Okay, next slide, please. KDHE program, Kansas Early Childhood Developmental Services, is what we're called at the state office. It's Infant Toddler Services of Kansas. That's the individual programs that exist. There's 29 of them across the state. And we serve children 0 to 3. We served 11,610 kids last year. Pretty good numbers there. We recently updated our baseline and targets. So these are brand new higher targets for the program that you're going to be seeing this year. Let's see. We have, we're going to talk a little bit about our general supervision system. The Kansas In-Service Training System, KITS as it's known, is what provides technical assistance to all of those 29 programs. For more information, you can visit our website, which is listed here. All right, next slide, please. So our first indicator is indicator 1, which is timely provision of services. In Kansas, we define timely service provision as within 30 days of the signing of the IFSP. This is a compliance indicator, so it's required to be set at 100%. Next slide, please. And we met that target, so 100% compliance on indicator 1. So pretty good for the state of Kansas. Next slide, please. Indicator 2 is services in a natural environment. The highest that indicator 2 can be set at is 95%, but we routinely exceed that at 99.86% in the most recent year. So met target. Indicator 3 is early childhood outcomes. And 3A is positive social emotional skills. B is acquisition and use of knowledge and skills. And C is use of appropriate behaviors to meet needs. All right, next slide, please. Indicator 3A on 1, which is children who showed substantial improvement. We met target at, so here is the target and here's our actual percentage. So target was 64.63% and actual data was 68.28%, so met target. The second is the number of children who were at age expectations by the time they hit 3. Our target was 54.97% and our actual data was 56.09%, so met target on that one as well. B, acquisition and use of knowledge and skills. First, again, is those who saw substantial increases, and the second one is met age expectations, and both of these we also met target. Next slide, please. C is the percentage of infants and toddlers who demonstrate use of appropriate skills or behaviors to meet their needs. This one, C2, we did not meet target, but we did not have any slippage because we actually did better than the previous year. 3C2 is one that we have not met target for many years in a row. We're looking into why that might be, but it is the only of the indicator 3 targets that we have not been meeting. All right, next slide, please. And I just wanted to show you that we did actually show improvement, so progress towards target over last year. Okay, thank you. Next slide. Indicator 4, this is our parent surveys. We've been focusing a lot on parent surveys the last few years. When I started in 2021, our survey return rate was 9%. It's now up to 19.8%. So we've made some real improvements there. We're hearing from a lot more parents, getting that parent family perspective. We've also added information about race and ethnicity to our reports.
to the federal government about, our survey returns. And so we're getting a lot more information from our family surveys and not just, these percentages, here. But I did want to note that we have met target on all three of indicator 4 percentages. In addition, the new data that we're analyzing, looking at survey returns by geographic regions and race and ethnicity, I can tell you that we have an underrepresented return on urban and suburban. So we're hearing more from rural and frontier families than we are from urban and suburban families. We have an overrepresentation of white families and an underrepresentation of Hispanic families. That is coming out clear in the data. We did analyze those two groups separately to see if we're seeing a different kind of return or different kind of response from those families. And those responses are consistent with the overall responses, so not statistically different from the families that are when you look at overall, families are reporting that Part C is really helping them. In the 3 main areas here, Hispanic families and urban families are reporting this kind of return at a similar rate. It is helping their family, it is helping their children, it's helping them know their rights, it's helping their children meet their needs. All right, next indicator, please. Oh, already hit that one. All right, where did indicator 5 go? There's indicator 5.
We did a double check.
Indicator 5 is the number of 0 to 1, the percentage of the population that is being served in that 0 to 1 age group. We didn't meet target. Our target was at actually 2.2, and our actual percentage of the population served is 2.02. I'm not overly concerned about this because Kansas consistently is above the national average on both indicator 5 and indicator 6. But it does indicate that we could spend a little bit of time strengthening specifically the relationships with those hospitals, because this is a lot of times these are those children that come to us out of the NICU, and those children that are showing signs early on of needing services. So there's a little bit of work here, but I wouldn't put this under a huge concern just because Kansas consistently is above the national average on indicator 5 and 6, which are both child find indicators. Okay, indicator 6, please, next slide. We did meet, in fact, exceeded target on indicator 6, which is the 0 to 3, the entire population. So Kansas is serving 5.38% of children in that age range. And like I said, above national average. All right, next one. All right, indicator 7, this is the 45-day timeline. So from referral to the Part C system to an IFSP being in place, we have 45 calendar days. This is a compliance indicator, so it has to be set at 100%. We didn't make 100%, but we got really, really close. So 99.82%, pretty good compliance numbers there. Next slide, please. Indicator 8A, this is one of the 3 transition indicators. Indicator 8A is the number of children who have a transition plan in place at least 90 days before the child turns 3. Once again, compliance indicators have to be set at 100%. We got 99.87%, which is not 100%, but it's really close. Next slide, please. Indicator 8B, this is the number of children who have the Part B notification happens at least 90 days before a child turns 3. So this is the notification to the local school district and to the state agency that this child that is potentially eligible for Part B is gonna be transitioning out of Part C. Once again, required to be set at 100%. We're at 99.31% on this one, which is our lowest of the three transition indicators. We're working on it, but looking nationally, this is a pretty good number for indicator 8B. Next slide, please. Indicator 8C, this is the number of children who have gotten a transition conference at least 90 days before the child turns 3. And this one is at 98%. Hello? Oh, there, okay. 98.8%. Pretty good numbers there as well. Next slide, please. I would like to note that the last few years we've been doing a lot of work in transition. Some of our gains have plateaued a little bit, but we're still seeing consistently more progress towards higher percentage in our compliance on aid. And we're pretty proud of that. So just wanted to note that. All right, next slide, please. So these two indicators are about dispute resolution. Part C has not had a formal complaint in a very long time. Yeah, I'm seeing you over there and I'm doing that too. And so these two indicators actually don't apply to us. We just get to say 0 and move on. And I like that, and I'm hoping it stays that way. Next slide, please. All right, indicator 11. Indicator 11 is actually, it's a special project. You can think of it as a special project that the state is doing. We're trying to improve the social emotional outcomes of children who qualify for Medicaid that are served in the Part C system, because their indicator 3 data is consistently lower than when you look at children that are not on Medicaid. So we had, we're specifically pulling these kids out and trying to improve their outcome scores, their ECHO scores. We met target this year. So our target was 45.2% of these children would have positive social emotional skills similar to same age peers by the time they exited at age 3. And we met target with just a little bit above at 45.8%. Next slide. So we have a brand new indicator this year, indicator 12. I love it when things are added, but here we go. Indicator 12 is required to be set at 100%. And what it is the number of instances of non-compliance that have not been corrected a year later. So imagine we find an instance where a child did not get their IFSP completed within 45 days, as is required. There are 2 things that have to be corrected in that instance. The child has to get their IFSP, like that's one, that's child level correction. And the second thing that has to happen is that program has to demonstrate 100% compliance on future review data. So what we do is we pull a month worth of data from a program and look to see if all of their kids are now getting their IFSPs within 45 days. So the federal government expects for that to have that process of checking that the child has gotten their IFSP and that that program has done 100% compliance for a month's worth of data. They expect that to happen within a year of any findings of non-compliance. Kansas is pretty good at that. It's actually not that hard
for us, because our compliance numbers are really low, or our non-compliance numbers are really low. And so it's relatively easy to get a program kind of through that double hurdle. So that's what indicator 12 is. I'm happy to say that first year that we've had to report this indicator, and we were able to report it 100%. All right, any questions? I think the next slide just asks. So
I have a question.
Yeah.
Okay, so Tricia, looking at indicator 3C, which is, I didn't really want to find, but looking at indicator 3C, which is kind of taking action to meet the needs, one that we did not meet. And I know you're drilling down with that. I know there's a lot of in that area. There's a lot of gross motor, fine motor, self-help skills, some personal social. I'm wondering how the nation is doing other than Kansas to look at that also, because I hear some things about, especially fine motor, how that is kind of an area in our nation that might have an effect on that indicator. So something to think about. I don't know if you've already thought about that.
So interestingly, there's a lot of conversation nationally about what's going on with early childhood outcome data, which is our indicator 3 data. This is the indicator that we see a lot more swings, if you would, in the overall data. Those move a lot more than really would be expected from year to year. There's not a lot of consistency from one state to another on what those percentages are. And so figuring out why we're not meeting that particular data point is difficult. We've actually, one thing that the kids team and I have done here recently, as we were looking at indicator 11 data, is that I went in and I pulled the echo scores for that reporting period, and I looked at scores by time that a child was in the program. And every time you break out even a little bit, you see data kind of all over the place. And so one of the things that we're going to focus on this next year is trying to figure out, what does this data really mean? Why do we see such wild variation from program to program and from year to year? And what is it really telling us about the children that we're seeing year over year? Maybe next year I'll be able to answer that question a little bit better, because we've been over this past 2 weeks, which granted half of it's been through snow days, we've been looking at drilling down into those numbers and pulling out children that get into the program early and stay in for 3 years, looking at the differences between programs, and looking at numbers for children who are only in the program a short time. And it's the variation between those things. We actually see more improvement for children that are in the program for just about 6 months than we do for children that are in for 3 years. And there's reasons for that, and we can go into that at some point. But I see those who are in the field nodding and knowing why.
Yeah, I was just going to echo, as a person in the field, I think one of the reasons that Susan spoke on and to potentially look at TA for is, historically, Part C programs were encouraged to think of that taking action to meet needs as your motor skills. So your gross motor, fine motor, self-help, but really it's language and it's social. And so I think about how many kids come into Part C and have speech only services, and I see a lot of our speech therapists rating kids very high on that particular outcome. So there's no way to show progress, because when they exit, they're still high. So I think we need to relook at taking action to meet needs is about language, and it's about social, and it's not about movement necessarily.
Yeah, one of the hypotheses floating out there is that we need better consistency in marking those echo scores. when children come in and for the, in case anybody's a little curious, early childhood outcome scores, children, receive a score at entrance and at exit. And then we take all the children that are in services at least 6 months and then compare the entrance score and the exit score, and that's where we get our indicator 3 data. In Kansas, we actually do the ECHO scores annually with children, so we track them, track those scores through the system. And that's another thing that we are not using data that we already have, is we're not looking at that annual score quite as much at the state level and seeing what trend lines are as children move through the system. We're currently just looking at the beginning and the end. So there's a lot of things that we could do with that data. We do know that we have some differences in how children are scored based on discipline, as Monica just kind of indicated. So there's a lot of room for figuring out and drilling down on that data. Any other questions?
Do you need a motion now to approve that today?
Yes, that would be brilliant.
So you can do this, but you have to turn your mic off. Okay, so you'd indicated that we would need to approve the annual report. And so I'd entertain a motion from the SICC to approve the SPP annual report. And Susan Bull has made the motion and Courtney Hodgman has made a second. Any further discussion? All those in favor of the motion from the SICC say aye. Aye. Opposed, same sign. Motion carried. Thank you, Tricia.
I would like to note. I would like to note that since I wrote the report, I am abstaining from that vote. Thanks.
We have a member who joined that committee, so we'll have her.
Okay, we do have an SICC member who joined. We're gonna have her do a quick introduction and then we will go to a break, so. Yeah.
Good morning. I apologize for the delay. My name is Deanna Martinez. I'm the Head Start representative from the Family Conservancy. Yes, ma'am. And the chair of the subcommittee that we're calling the Systems and Service Committee.
Awesome, thank you and welcome. So we are just a little behind schedule, but this always ends up working itself out as we go. So I think we're gonna go ahead and move to a break, and I think we'll stick with the 15 minutes. There are, like we said, refreshments over here. There's water on ice back there. Restrooms are up the hallway, or there's some right here around. There are some cozy chairs, but get up, stretch your legs. If those of you are online, same thing, and we will be back here at 10:30.
Technology working.
No, I don't know about that.
Right. I did. Don't ever get on. Well, he sent me a bag. Oh. What you doing at home? Here. And it, I don't know that. I think it's a tough one. No.
You're finding everybody going, okay, I think so. I'm checking in with them right now too. That's okay. I'm just glad we got it.
Yeah.
Connected.
We have a good spot right next to the
I think I might get me one too.
They're nice.
Yeah.
When I did services, when I was good, we had a client, we needed to get some consistency, but she would call me. Because somebody said that.
That's green, I don't know how you do it, because it doesn't show it.
Oh, I know, she did say.
It should be the break sign. How do we determine where we start? You know.
So where does that screen stop at? Is that the one you're trying to get rid of?
I'm trying to.
Which one?
Well, this is the YouTube live and this is the Zoom.
Okay,
But for some reason, why is that?
well, what's on that screen right there? Can you pull it up? Pull that screen up into the, can you pull it up at all? Can we see what, can we see what that screen is? Because I think that is the one.
Click some things and they're not working and I don't know. It's very frustrating. So they can't pull that
Click
one.
on that one. That's a good, right there, right here, go right up there.
I love the wide-legged stuff.
Nothing seems to be working.
I don't know what's going on. Well, you're sharing that. Can you
Right,
stop
but
the share?
No, yeah, I can stop the share. That'll take the break sign and everything. That'll take everything.
All right, but then take
that's
that
still
out.
up there. I
Screen.
don't know.
There's that, where's that?
Here. Would you think it would be down here?
Put down here.
Here.
All right, then what you do is just exit off.
Sorry.
Okay. Save your change. Oh, it wants to know if you want to save your changes. So click your arrow down and just save them and then it should close it. Yeah. Can you get your arrow on
I'm
and save?
trying. Get over there. Here, let me see if I can.
Because if you hit the save, there, it went away.
Okay. Did it?
And then it came back.
I can't get to it to make it
And you
go.
don't have a touch screen, do you?
Well, it's not even bringing it up. I mean, when I click that,
Uh-huh.
it just goes away. I can click the X,
Yeah.
but then I can't.
Because it wants to know if you want to save the
Right, and I
changes.
can't get up there.
I get
My
it.
cursor was up there a minute ago.
It won't change screens. That's right.
Ten of them.
So is that screen two?
Yeah. So let me see, let me try this. If I go into share. And I go here, and I wonder if I can delete it there. And I right click. Right click or X out. I don't.
There's your little red save button right there. But no, it won't. Oh, it's so frustrating. It's that computer. Let's see, that's screen one, that's screen two up there. And you're trying to get here to screen two is what you're trying to do here.
I may have to bug Dean again. Make it go away.
That's when you want. Yeah.
Well,
No, it's not what you want.
That
doesn't do it either.
Oh, that's it.
I said it, and I'd be like, yeah.
But I'm just wondering where we find this screen. We should find screen. There aren't screen ones here, but go to two. That's what's in there.
I think.
You're right. Yeah, just click at it. Yeah.
I hate budgeting again.
I'll tell him to come and work with you.
Thank you.
Or at least know more about what's going on.
You can leave it open. I'm headed that way.
No, yeah. I know that Violet is. Yeah, and I know another friend.
He's trying to get that off the screen. Do you actually, you don't want to say that, do you? You want to just say cancel? There you go. It's just, so think of it, don't think of it as it's left and right. Yeah, so it's just, so it's on the right side and then this is to the left. So left and then watch, go over here to the right.
Okay.
So think of them as, just think of them as two different monitors. Yeah, yeah. So it's just the, oh no, I totally get, and the reason I know what it is because I've gone through exactly what you're going through so many times. It's through trial by fire.
This is my fourth or fifth time.
Oh no, but it still takes forever. Yeah. No,
Okay, so
no.
left, right.
Yeah, no, you're good. It's because I've managed to screw these up every way possible. What's up?
Okay.
You know what I mean? Like, so if it's only like.
we have the SEAC SPP APR report with Brian Dempsey.
Thank you. Good morning, everybody. Again, I took the PowerPoint I presented last time and decided, since you were so excited with it, I'm just going to use that and update it a little bit. And I'm not going to stand, and Tricia and I are going to switch next year because I have slippage statements and she doesn't have any, and I have 18 indicators. That's okay. All right. Joyce, if you want to go through a couple slides, this is the same submission that Tricia does. Oops.
Sorry.
Nope.
Okay, hold on. I just shared your.
So the same time frame. Our submission date is the same. It's February 3rd this year, because February 1st is a Saturday, and we'll probably hit submit January 29th or 30th in case something happens.
Okay, hold on. I think this is it. And it's not showing up.
And just as an update, when we talked last month, we had most of our data. So a lot of this, I'll just go over quickly for those that are new and for our partners, where we're at. And then I'll hit what's new. And we do have some data that's not quite finished. So our indicator 3 data, our assessment data will be uploaded into EMAPS, we hope next week, but probably closer to the end of the month. So we use our raw data and we think we're pretty close. We were last year. We had the same issue last year. There we go. All right, cool. Thank you, Joyce. And Joyce, if you'll go down to the next slide, please. Okay, just for a review, our indicators, so 1 and 2, we went over last time. We met the target for both for graduation and dropout, so we had no slippage. And our baseline years I note in there as well. For 3, you'll note the data is not uploaded yet, and so we're using our raw data. A and B, we think we're going to be okay as far as slippage goes. C and D, we have a couple slippage, and we'll go through those later. So the bold is what we didn't cover last time. So that's new this time. 4A and B, I didn't put anything in here. We're still analyzing that, and we're reviewing that with our federal TA support provider, IDC. We do think we'll have slippage on 4A. So this is expulsions and suspensions. And 4A is significant discrepancy. 4A is just in general for districts. And we went from, I think, 12 districts in 22 to 15 in 23. So the slippage is an increase in those that are potentially non-compliant. These are not non-compliant districts. They're just potentially non-compliant. The slippage really boils down to, remember, we changed our methodology. So 1 student with suspension can trigger this. And so for smaller districts, that 1 to 2 students sometimes will trigger them to be 3 times more than the state average, which is our methodology. So that small increase in the number of districts we think ties in because the new districts we identified were pretty small. So that's 4A, 4B, we're still looking at the data. I'm not sure we'll have slippage on that. Indicator 5, we have no slippage and we met our targets. That's educational environments. Joyce, if you go to the next slide, please. And then our early childhood, 6 and 7. For 6, we had no slippage, and that's the preschool environments. And then 7 for our outcomes. So 7 is like Tricia's indicator 3. Her indicator 3 is 0 to 3, ours is 3 to 5. That's the difference, but they're the same measurements. And we did have slippage for A and C for both of those measurements, and B for the first one when they come in behind and they didn't make any sufficient progress. Indicator 8, where you don't have any slippage and we met our target. 9, we don't have any slippage, so these are new, these are bolded. We don't have any slippage and we met our target, in 9 and 10. And remember, I put compliance for those that are compliance indicators, like Trish's, ours are 4, 9, 10, 11, and 13. And then 10, we did have slippage, and we'll cover that in a little bit. 11, we did not. Next slide, please. Oops, I went the wrong way. So 12 is the transition. We didn't have any slippage. We're wrapping that up, but we have the data and that looks good we didn't meet the target. That's a compliance indicator. So that's 100%. We're in the high 99s like we have been. 13, there's no slippage, and 14, no slippage. We covered those last time. And then 15 and 16 are our dispute resolution indicators. Like Tricia, we didn't have many historically, so we didn't report. We have the last couple of years hit our threshold of 10, and we hit 10 for both, but we met our target actually for 15. We did not meet our target for 16 for mediation, but there wasn't any slippage for either of those. And then 17 is our state systemic improvement plan, and there's no slippage there. We did meet our target for that. 18 is our general supervision. It's Tricia's new 12. Ours is 18. And this, I don't have in here. We're working on that as well. We've sent that to our federal technical assistance support person, our team, for review. And we just received that back this morning with feedback. There's some feedback on the narratives we'll review. So we might do, like Tricia indicated on hers, a little tweaking on the language. But our data is fine. So if you remember, this is the same general supervision as Tricia's indicator 12. So it pulls down all the indicator outcomes we reported in our compliance indicators, the non-compliance and those that came into compliance within 12 months. And then we went through our system and reviewed all findings that were related to any of the compliance indicators and reported those. All the findings that did relate, that weren't part of the compliance indicators, but did relate, those districts came into compliance within a year. So from a numbers perspective, everything we report is going to be in compliance within a year, for both the compliance indicators and for those findings that related to the compliance indicators. So that looks good. Okay, Joyce, next. There you go. So indicator 3C had some slippage statements. Indicator 3 is assessments, and 3C is the proficiency in the alternative assessment. So these are students with the most cognitive disabilities who take the DLM in Kansas, or the alternative assessment. And there's 2 sections, reading and math. This is reading, and they measure the 4th. So the group name really is 4th grade, 8th grade, and high school. And we don't think we have slippage in high school. I'll just jump to that, but we're waiting for that to upload in EMAP. So that might be one we'll have to look at. The slippage is in 4th grade, and you can see there, we didn't hit our target. We did in last year's submission, and our slippage is pretty significant for this year, but we did not have slippage in 8th grade. So
Jay, you in the bathroom?
So for indicator 3C for math, it's the same. So we have slippage in 4th grade, but we do not in 8th grade and high school. So we did a deep dive on the data for this and the slippage statement. Joyce is the next slide. And it's quite lengthy. So this is in the materials. You can pull it up and look at it. And I'm not going to read it to you, but what we did was we looked at the 22 cohort and then the 23 cohort and measured what they did in 3rd grade to 4th grade. So the 22 cohort are older, and this does relate back to the pandemic. So when they were getting their foundational learning, they would have been in first and second grade when they went remote, or second and third. And then the kindergarten first graders are the 23 cohort. And when you look at their outcomes, there's a great difference when they hit third grade and took those assessments. There's a huge gap in the performance of those two cohorts. And then when you look at the fourth grade that we report, that gap shrinks a little bit. So they did make some gains, but there's still a significant gap. And this really boils down to, we think it does relate back because of when they came in and had that foundation. Okay, 3D is the proficiency gap from students with disabilities and then all students. And our slippage here was in 8th grade for reading. And that's it. And a little bit of slippage, not as significant as the proficiency for the alternative assessment. So the next slide has this slippage statement. This one boiled down to chronic absenteeism. And again, you can pull this up and look at it. It's a little blurry. I apologize for that. But the bottom line is the chronic absenteeism for 8th graders with disabilities, where we had slippage for the 22-23 year, which is the measurement, was 32%. And the chronic absenteeism for all 8th graders was 23%. And that was a pretty significant gap. So we think just that absence of being in school and receiving instruction is indicative of the slippage that we did see for 3D. And there was no slippage for math for 3D. Okay. Indicator 7 is the same as Trish's. It's the acquisition, socialization, and then self-advocacy, A, B, and C. And then they're broken into 2 components, 1 and 2. 1 is coming in under where they should be and then making significant gains. 2 is you just are growing as you should. And then our slippage statements are for both in A and then for B1. So those that came in under where they should be and not making substantial gains, and then C for both. And I do have it here. It's for age 3 to 5. So that's the difference when you think about Trisha's and early childhood indicator 3. Theirs is birth to 3, ours is 3 to 5. So I did put all the data in here. So B2, next slide, Joyce. And you can see the slippage. So I put the target in, and so the slippage is more than 1% because these are large, greater than 10% targets. And I don't think there's anything real significant, I'm going through again, as in the assessment indicators, but there is slippage, and we didn't need the targets. So the slippage statements are the same for all, and it does relate back to the pandemic and staffing, and then also some subjectivity possibly in the child outcome measurements and team decision-making and documentation. So what we have been doing for several years is working with providing TA to staff on how to measure improvements and try to be objective and not subjective. So those scores have improved, I think, but we think there's still a little bit of that, and that's an ongoing process for us. Okay, indicator 10 is significant disproportionality in identification. And we did have slippage there a little bit, and that is, next slide, Joyce. We might edit this one a little bit, but what we did was reviewed our policies and procedures and practices internally that we use to measure districts that are identified against the federal policies and procedures and practices. And essentially what we did was strengthen ours. So it's a little more rigorous now. So when we are reviewing districts, it created a couple more identifications, which led to the slippage. Again, like indicator 4, I think this is a couple of districts that were identified. Okay. The required actions for compliance indicators, I left this in here. If you recall, this is just boilerplate for those that the compliance indicators, the outcome is 100%. And if you don't hit it, then you have to explain how you got the district to come into compliance, and then for the individual student files as well. And this is boilerplate for all the compliance indicators. You don't hit 100%. And so we do explain that. But for indicator 10, we did have a district that had ongoing, oh, I'm sorry, Joyce, next slide.
Oh.
Ongoing non-compliant, so they did not come into compliance within a year from 21 to 22. So this is whether or not that district came into compliance in that second year, and they did. So that will be reflected in our submission. The next two slides are indicators 8 and 14, and basically this is about representativeness. Tricia talked about that in the parent survey, and what we had in our required actions was addressing our representativeness. So we were overrepresented in white, underrepresented in Hispanic in FY22. In this submission, it will be overrepresented white, underrepresented African American, and Hispanic for indicator 8. Our actions are similar to what we had last year, working with our partners, with SEAC, with Families Together, with PERT, with the KSDE stakeholder work group. And the other thing we added to, Trish was talking about breaking down the data, urban versus rural, but also looking at our larger districts that have more diverse populations and reaching out to them and providing some more technical assistance on how can we reach and improve that return rate for parents. And then indicator 14 is similar. They are overrepresented and underrepresented with the same populations. This is outcomes as well. So remember last year they were overrepresented in students who graduated with a diploma and underrepresented in dropouts. And that's the same this year as well. So the action steps are the same with the addition of targeting the larger districts where this is an issue that we can identify, and working with those districts on getting the returns from that population. I think that's it, Joyce. Are there any questions for Bert or I? Oh, no.
I have a couple of questions, and I thought about it with Tricia too, but now that you both talked a little bit about the echoes, do all states use that process? I was thinking they were, and I think, correct me if I'm wrong, a lot of states have trouble with that reliability or that inner comparison of things, but there isn't anything else, and so that's what we have. Okay, that's what I was thinking, but I wanted to confirm. And then the other one, in terms of slippage, was that kind of a national trend with the pandemic that lots of states experienced slippage as well?
I haven't looked at the data. My assumption is yes, because all the other trends that are related are pretty consistent with us. The increase in complaints and due process filings. So that's why we've actually hit above 10 this year. All the other findings we've looked, the staffing short, everything else you look at with trends is pretty consistent nationally. Tricia, would you agree?
Any other questions before we move on in the room or online? Okay, moving on the agenda, we have the SICC ESIDS, is that correct? Okay, with Trevor Hoffman. Or Huffman.
Trevor wasn't able to come.
I think we have his presentation. Did we get that? What did it go through?
I don't recall receiving that. Is it in the email?
For those of you online, we are checking to see if we have his presentation. He is not present today, so give us just a moment.
Sorry, I got a lot of emails here.
Or he was under the impression that he sent it to you and you were going to go over it.
I can, but I'd like to add it.
Okay.
Okay, I think we are working on getting that slide deck shared and that Bert's going to review that for us.
Okay, it'll take Joyce a minute to get that loaded, but it's the Early Childhood Integrated Data System that our IT system has established. And Trevor is sorry he couldn't be here, but he did send it to me. There it is. And so we'll just go slide by slide and review that so that you have time, since you didn't get it ahead of time, to review it. So if you can get us to the next page, Joyce. That was fast, by the way. Let's give Joyce some congratulations.
One thing right today.
We got it figured out. So it's statewide longitudinal data system. It combines data from multiple agencies to help answer some questions about student learning and outcomes. The SLDs can include data from early childhood education, K-12, community colleges, four-year colleges and universities, and workforce programs and services. And an SLDS can help educators identify students' academic strengths and weaknesses, increase student achievement, close achievement gaps, identify and address potential recurring impediments to student learning. So that tells you what the statewide longitudinal data system is designed to do. Trevor will explain to you at your next meeting how that's being done, but we will go to the next slide, which should give us a little more explanation. That's what it is. So an early childhood integrated data system, which is ESIDS, and how many of you are familiar with that? Oh, a couple of you. See, the experts are in the room. We can give them a microphone. Collects, integrates, maintains, stores, and reports information from EC programs across the multiple agencies within a state that serve children and families from birth to age 8. Very similar to the language proficiency assessment that's being done with hearing impaired children, which is also done from birth to age 8. But I regress. Let's move to the next slide.
Sorry. Trying to get it, evidently it's not sharing online.
Oh, sorry.
That's okay. We'll go forward.
So the data integration is a high priority for those seeking to make data-informed decisions. We all know that data drives our practices, or it should. Facilitates the technical and organizational collaboration that leads to data-informed cross-program planning and decision-making. And I think that's kind of why we're here today, is some cross-program planning and discussion and review about how our interagency councils are similar and different. So it's integrating data, supports both child and family outcomes, and allows us to improve services. So public health issues span multiple sectors. So it also has the health issues that are included. Childhood illness not only falls on healthcare providers, but also falls on educators, schools, families, and communities. And we're getting it shared now. So we have another slide.
Okay.
It's not a long presentation.
Thank goodness. Oh, hold on. My computer is not. Okay, there we go.
So expected outcomes of the grant. So as you can see, it is a grant. It's connecting early childhood data from multiple systems, state agencies to affect positive outcomes and policy for children to thrive. It's a robust data governance system that ensures that ESID provides data that's secure, valid, reliable, actionable, and provides useful insights for informed decision-making. And it also provides the ability to calculate a distinct count by assigning every child participating in early childhood programs a unique identifier that is consistent across early childhood platforms and remains constant through PK-12. So it is a data collection system that allows us to track how students are performing and growing. So we have individual student data that then becomes aggregate data to give you some idea of how students are progressing. It's really good for researching as well. And I think there's one more. So also architect a centralized ESIDS infrastructure that is flexible enough to stand alone, it's scalable, and integrates with the P2OW SLDS, which is technology-based data gathering and collection and storage. And it produced customizable data analytics dashboards to provide reliable, high-quality, actionable data to early childhood and education stakeholders. So as you can see, that's in the design format at this point in time. Because I don't know, Stacy, that we have requested any information or that we have this data established at this time, but it's in the planning phase.
Yes,
I'll give you the microphone so you can share.
and from my understanding, what they have completed is, so this is being led by KSDE, and they have been working with DCF and KDHE to develop user agreements so that they can share their data. So like if a child is in Part C services, they're going to get an ID number, like we currently call it the SSID. And we'll be able to track them over time. Or if a child is in parents as teachers, we'll be able to look at that. So like if you have a child that's been in elementary school and is quite successful in their state assessments, one of the things we'll be able to do is look back and see what services did that child receive up until that point. And is there a difference between their family participating in parents as teachers or some other home visiting program that our children have opportunities to do. So it's really exciting to be able to think about really drilling down to see which programs are effective and are really making a difference long-term. I think the goal is 2 years to maybe have it up and going.
So it is in the design phase right now, and you just saw a list of the people that are organized at KSDE to try to make this happen. I can't answer a lot of questions about it today, but Kyle Ward or Trevor can provide you with additional support since they both serve on that planning committee. Kyle is an assistant director of instructional technology at KSDE. He was filling in when they had an opening for the director position, and we now have a director of IT at KSDE. So if you do have any questions, you can if you're SEAC, let Lindsay or let me know. We'll make sure we get those moved along, or you can let Stacy know, and Stacy can then inform the SICC. But we thought it was a really great topic we wanted to bring to your attention today, that this is in the planning stage. Of course, parental consent would have to be given somewhere along the line. If we're collecting PII, that becomes very sensitive. We want to make sure that it is protected and that it's not accessible from outside folk, if you will. So I think it will be aggregate data, but you could also have an opportunity to view the individual data if you had a need to know. I think it's exciting. I think it's a great opportunity to finally see the difference between birth to 21 and see how the kids are performing. Any questions that I could answer? Probably not much I can answer other than to tell you stay tuned. Since it is in the planning stage, this is something that we'll talk more about as it becomes more close to fruition and actually being implemented on a pilot stage, I'm sure, at some point. Thank you. But we thought you'd know what that means if you hear it. Hear about ESIDS.
Thank you, Bert. Next on the agenda, we have the SICC and SEAC C2B, some conversation about just what that looks like and transitions. So Brian and Stacy. They're gonna rock, paper, scissors it to see who's gonna start this wonderful, impactful presentation. No, Bert's not. This is all you, Brian.
I forgot the microphone.
I know.
Okay.
I mean, I could do
Oh, They're gonna sidebar for a minute, so bear with us.
That's a good segue. Sidebar.
Oh, okay.
Kind of what we're doing.
Now that we've had our conference, do we know what we're doing? Oh. It's dead.
You should be back now.
Thank you, because you shut yours off. We've had our conference, so now the plan is we know what we're doing, so we'll share out. You want to start, Stacy?
So,
Sidebar didn't matter.
yeah, KSDE and KDHE have been meeting monthly. I bet we're coming up on a year now that we've been formally meeting monthly to talk about transition, because we get a lot of questions across the state as children are moving from Part C, the infant toddler programs, to preschool programs. It's not as smooth and efficient as we would like for it to be. And so we've been meeting monthly and talking through issues, what's going well, what isn't going well. And sometimes we'll talk about specific issues and we'll come up with clear guidance and provide that guidance to special education administrators. We'll provide it in some of our trainings that we have. Our latest improvement to our meetings is we're also making sure that if there's an inquiry as to how they should be doing something or what are the details of it, they just need some clarification in a specific district and infant toddler program. We're trying to make sure that we then share the clarity with both the special education program with the LEA and the infant toddler program. So they're hearing the same thing, so that infant toddler isn't saying, well, we talked to KDHE and they told us this. And then the school district's like, that doesn't sound quite right. So we're also really working on making sure we're giving everybody all of the information.
And as Stacy pointed out, and I'm pretty brief, but, so I echo that. I think they've been really helpful and transparent, and then working across the state with our systems as well. The other thing we're doing is Tricia and I are meeting with families together periodically as well to have those ongoing conversations and get the parental input from Leslie and what she's hearing, and that's been very productive. So just to echo that, and if there are any questions, I think we would take that, but I think we just wanted you to know we've started that process at the state level and then with our partners.
Is that everything? Oh, just a second, Bert's has more, hold on.
So one of the issues that we were encountering is during the on-site visit from the Office of Special Ed Programs, they interviewed different parent groups. They interviewed both KDHE and KSDE folk, and they had some concerns that came up. They were told some things during that visit. And if there was one thing that was shared, they thought of it as being pervasive. So if one parent or one provider said, well, this isn't happening or this happened, then it seems to be that OSEP thought, well, that must be happening all over the state. And so we at KSDE then had to assure them that we were providing appropriate guidance to the field and that we were working with KDHE, that it wasn't oppositional. And one of those things that we talked about is that all of the districts were supposed to have a local interagency coordinating council. And was that happening? And what were they doing at that LICC? Because it should be Part B and Part C, because I had Part C for 10 years when I was at West Elk. And I was a fiscal trainer for KDHE to go around and train about how you build your fiscal services. That's back in the 90s. Well, that's how long I've been in the business. Been longer than that, but anyway, I digress. One of the things that was a concern to us is how can we be consistent across our mission? For example, we had Part C folk said that they were telling the Part B folk what the kid needed when they transitioned, and the Part B wasn't listening to them. They were doing something different. So who takes over the control, if you will, for the student program at age 3. Does the Part C provider still have influence on that? They're invited to the meeting. They're supposed to be providing some information and supports, but does Part B then take that on? And what do we do when we disagree about services? Another issue we were hearing was that some of the systems were requiring screening of students instead of going to a comp eval. And I have met with Part B directors on multiple occasions and said, you have 2 things you do. You have a prior written notice that says we will evaluate the child because they're already identified as having a disability by being in Part C, or you send one that says we won't, and here's why. And then the parent can file paperwork to get that evaluation completed. So I want to be sure that our providers knew screening is not allowed. Screening takes place in Part C. You all do that when you identify. If it's a child find issue for a child not yet identified, then yes, Part B would have the responsibility to do from birth to age 21. That screening is for non-identified students birth to 3, but you can have agreements like we did, where we worked with our Part C providers who attended our child find at the district level. And then they took on the onus for the Part C eligible children from birth to age 3. So we wanted you to be aware that we're aware of some of these concerns and that we're addressing it from a Part B perspective for where the accountability responsibility falls on Part B. But we also want Part C to know we're not just deaf-eared about it and that we're just ignoring when there are differences of opinion about what should be happening. So really, when we set this up, it was to have that open discussion about what was Part C seeing, if they're seeing anything that's being unresolved, and you may have a system out there, and believe me, I work with them, so I know, and that system is very difficult, but that could be brought to the table for Part C and Part B to have the discussion, and then if Part B needs to intervene and meet with that director of that system, then that's what we need to do, so that we can make sure that we're following appropriate practices. So that's kind of why we set this part up, because we haven't had this opportunity to meet as C to B for 3 years. We had it set up originally 2 years ago and it didn't coordinate well. Then last year we had the ice storm. So, and we had to cancel. And then we set it up on a different day. So anyway, not making excuses. But this is a unique opportunity to have both SICC and SEAC here. So if you have any issues you want to bring to the table, now's a good opportunity to present them before lunch. Yes, Trish.
I want to say that I'm still relatively new to the Part C system. I've been with Part C since 2021. And since that time, we've been working a lot at the state level to get better communication across C and B. And one of the things that we've been doing is when we see hotspots, as I call them, where there's some communication problems at the local level between the local Part C partners and the local Part B partners, we've been going in and having meetings, lengthy meetings between these partners, between the so the local Part C program, the local Part B program, and the LICC. And we've gone out and met in person with these groups to work through those communications. And you wouldn't believe, like, you get there and you think these folks are never gonna agree on anything. And then by the time you work through everything, you do have agreements in place and everybody is back on the same page and everybody is talking again and having communications, because when it comes right down to it, both partners do want what's best for the children. You just have to get to that point. It's a long process sometimes. And, but just like everywhere else, we do see an increase in disagreement between people. That's happening at organizations, and it's happening at organizations that I am participating in, like nonprofits and stuff, and you're seeing it, which is, you know, when we were talking about increase in complaints, that's another thing that we're seeing. But getting in the same room with two people, and working through it, it works. And talking regularly at the state level as to where we want, programs to go and how we want to emphasize the importance of communication. This has been really great for Kansas children as a whole. That's all I wanted to say, Bert.
Is there anything that anyone wants to share, B or C, that kind of centers around issues that you're seeing or things that we may be able to help address, things of that nature? I will happily get you a microphone.
Okay, Kate. Because I work in both the Part B and the Part C world, and I'm at a lot of directors' things and I'm at coordinators' things, there's a couple things that keep coming up. And I'm sure that many of us all know those. And at this level, we know about them. But at the provider level, I think sometimes there's confusion. But the rules for qualification are very different between Part C and Part B. For example, in Part C, there's no like 504. It's like if there's a disability, they're going to qualify. And so when you do the transition meetings, sometimes the Part C providers don't understand when Part B says, well, they're not going to qualify now for us because it has the two-pronged test, a need along with disability. So there's some things like that that I think sometimes are confusing between the two worlds. The other thing is, and even at the federal level, it's been very confusing for me, is that we have natural environments in Part C, and we talk about working in the home and very closely with the parents. But when you get into Part B, home-based services technically are a more restrictive environment than, for example, a preschool with other peers that may not have disabilities. And that's a big shift in a different way of thinking. And so sometimes those kinds of nuances really are confusing, even to those in the business, but to a lot of the providers that maybe don't know those things. So again, I think both KDHE and KSDE have been working, as has been shared, with educating each other on the differences in our programs. But I think that's so often a communication piece that people just don't understand how they're different.
Anyone? Okay, Erin?
So I am coming from, I think two perspectives, but I am a chair of an LICC. And I feel like I do appreciate the state level conversations that are now happening because I think it has been a real challenge. I think LICC struggle to know our roles when these situations come up and how to help. And honestly, I'll just be real honest, we would not have gotten anywhere had we not gotten involvement from both KSDE and KDHE in our specific situation. So I very much appreciated that support, but also felt extremely helpless as an LICC to be able to help our Part C partner and also work to have a good negotiation and a good partnership with that Part B partner. So I think that has been, I don't think we are there yet with the one that I'm the chair of, but I think we are obviously making progress. And I also just think there are still ongoing challenges with continuum of placement discussions. So I think that is an ongoing issue that I think that's some of why Part C feels the need to be involved when they see the continuum of placement not being offered as part of a discussion, so that's just my 2 cents.
Is it okay if I talk just a little bit about LICCs? Because I'm not sure everybody in the whole group, I know we talk with a lot of acronyms. So just as a general overview, each infant toddler program is required to have an LICC. So as we are the SICC, the State Interagency Coordinating Council, they have a local interagency coordinating council. And that's actually one of my favorite parts of my job, is attending them, because I'll be sitting in the room in a community and there will be people there from the health department, people there from parents as teachers, people there from the school district, infant toddler providers, daycare providers, parents. I'm starting to see more parents. As a SICC, we're really trying to promote that and offering money for LICCs to get their parents there, and we're starting to see more parents. There'll often be representatives from different charities there that support families who are in need, and they just have some really great conversations about what's happening specifically in their communities that they're seeing, that they can work together on. Like, it's been several months ago now, but they were talking about they had a new group of refugees coming in, and there weren't a lot of interpreters in the area. So what were other programs doing to be able to communicate with them? And it was brought up that the health department, I believe it was, hadn't seen any of the infants yet. And somebody else said, well, there are infants in the community. So let's see, what do we need to do? Who do we need to reach out to get these infants, you know, in for a checkup? So anyway, really great things happen in the LICCs. They're all very different, but it's just so fun to go and see all this huge group of people. One of my favorite things is when I'm joining, I usually join virtually, and they'll discover they don't have enough chairs, and then somebody has to scramble around and get some more chairs, because more people came than they were expecting. And it's just really a great thing to see in the communities, with them all working together. Like, what do our families need, and what do we need to do to support our children who are birth to age 5 and even older.
Thank you, Stacy. Is there anyone else that would like to comment on anything in terms of transition? Anyone online? Bert has something to say, but is there anyone online that would like to speak as we're transitioning with microphones?
Yeah, is there anyone online that wants to say anything at this point? And then I'll make my comment. Okay, well, you can hold your peace if you want to. You mentioned the continuum of placements. I think that's critical when considerations are made for students with significant disabilities in particular, and we know who those students are. And we have to look at the preschool as our first opportunity really to serve those students. And then what support can we provide them? Because one of our indicators is indicator 6. And if you look at your sheet, that is the least restrictive environment. So we do collect the data on least restrictive environment, and we want our students served with general education students. So when you have a system that says we don't offer that, then you need to contact KSDE. You need to let us know that, because that is the wrong thing to tell any parent or anyone that we don't offer that. We have to have that continuum of placements as an option from 3 through 21. And just because the school district's never dealt with it before, that doesn't mean that they can put their head in the sand and ignore it. I think of every child as my individual child. And what would I want for my child? I don't think in terms of systems. Never have. And in my role currently, I don't. Because I think about each child getting what they need and in the least restrictive environment. So I think you'll find that our agency is very supportive of you if you let us know you're hearing that. Because we were told at one point, there was an agency that said, we don't serve 3-year-olds. That was the wrong thing to say. So once we know, we'll deal with it. But please let us know if you're running into issues and problems with individual districts, because I know they're out there, because I had to deal with them a lot in my experience. And I'm continuing to do so, but we want to train them. We want to help them to be sure that they're meeting the requirements for our students and our parents, because we can't forget we have families involved here too. So once we all work together, we can do great things.
Yeah.
I was just gonna speak, Bert. I love what you said at the very end. Like, when we all work together, we can do great things. And My parents taught me, if, no news is good news, but I've learned that is not true with transition. So never assume it's going well just because you haven't heard. And so one of the things we've started doing with our Part C and Part B programs is we're meeting quarterly, just a quick catch up and check in. It's hard to talk about things, that aren't going well. So we do roses and thorns. That seems to kind of help people share things that again are going well and things that we can tighten up. And it's really been nice from a coordinator and director standpoint, because then we can go back and gather information, and it's more of a conversation instead of, when I get that email from a Part B partner, my heart drops and I start sweating and, nothing good ever happens. But now I actually look forward to hearing from them. And that has not happened overnight. And things are not perfect, but it definitely is about working together and understanding the systems aren't the same. And I don't fully understand Part B and eligibility. And that's my responsibility to also talk to our Part C staff about that, because they don't understand Part B eligibility either. And so again, just kind of deferring to the experts, so to speak. So again, we know why children are and are not qualifying. We may not always agree with it, but referrals come to Part C and they don't qualify, and referral partners don't agree with it. So again, it happens to everybody, just at different parts of the referral process.
I have a question. Thank you, Bert. And I wanted to thank Erin for bringing up that continuum of services. And I think, again, it is maybe just not a lack of understanding about what certain things are. For example, between Part C and Part B, least restrictive environment versus natural environment. And, even our inclusion committees looking at this and getting a better understanding of what is homebound, what is home-based. I understand that preschool is considered a least restrictive environment from home-based. Did I hear you right, Kathy, when you said that? Maybe I didn't. Okay. And so I guess I'm wondering, what kind of a situation in a preschool would a home-based situation be appropriate and be part of a continuum?
Yeah. I had that happen with an immune deficient child who the physician recommended not be around other children due to they had significant illness whenever they had any little bug, any cold, and it could take their life. So that would be an example of when we have to look at consideration so that we're looking out for the safety of the child. Some parents may request all right, there we are. I'm back. So I think that's the main thing is you have to look at it individually and you have to consider what the parent wants at the time. Sometimes you start out with the home base because the parent is not comfortable giving their child it. So I'm just going to say that sometimes you start there, but you have a plan that you want to gradually move the child to more of a center-based program so that they have integration and inclusion with normally developing peers, if you will. And that's what inclusion is all about, because you learn better from peers. And so being with your peers, you're picking up the play skills, socialization, the learning, those sorts of things happen. So that's what I'd suggest is consider the needs of the child and then you work from there, because home base should not be the first choice.
That was actually a great jumping off point for my comment. From the parent side, I appreciate that no news is good news, but we want news, even if it's just, toileting news. I'm gonna tell a tiny bad story. I had a special education director when home-based services were requested for my son. He's almost 16 now, and this would have been either late elementary or middle school, and I was told that he wasn't disabled enough. He's complete care, nonverbal, non-ambulatory, but he wasn't disabled enough. And so I asked her, I said, well, who makes that determination? And she said, oh, well, I do. And yeah, I wasn't quite the advocate I am now, or connected. And so, you know, I share that with other parents because that's not right. And so I think partnering, you know, BNC partners, partnering with other decision makers at local levels to know these are the things, you know, that we must do. These are services we provide, but there are always options. And like you say, go to the individual child. What's working for the family right now? You know, I didn't want to pull him forever, but it's a safety issue for kiddos like mine when there's a para shortage, and we've had a para shortage for a long time. You know, one-to-one is a dream, and maybe someday some child will get one-to-one. But yeah, I wanted to share that because it echoes everything going on here. So it's not just, you know, like BNC, but it's also BNC and families and local folks that, you know, are administrators.
And I think that's why we involve the PTI, because we do have the Parent Training Information Center. Families together can be very supportive of families. We also have dispute resolution that at that point you could have said, well, I'm going to file a formal complaint with the state of Kansas. And then we would have an investigation once we looked at the IDEA issues, and then a determination made of anything that may have been out of compliance on the part of the school district.
The other thing. The other thing that, you know, why I'm blessed to sit here with you is that not all parents have the time to do that. And so, you know, a lot of times it's, you know, you weigh it and go, is this a fight I want to fight for? You know, is this really essential? And sometimes it's not, because you have to go fight with insurance over a medication or a wheelchair. And so, yeah, but it's good to know. And that's why I love being here and sharing with other parents in my community. It's like, hey, here's who you need to talk to first. And if that doesn't work, you know, I'll tell you the next person, and just creating those connections. But
it's great you've been there so you can be an advocate for other families.
So one of the things that we've been working on is getting these interagency agreements in place, C2B at the local level. And, you know, sometimes I get questions about why do I need an MOU with our C2B partners? And it's all about understanding who is responsible for what and what the expectations are between the two agencies. And for C to know what's supposed to happen with B, and for B to know what's supposed to happen with C. Because sometimes when our providers have built relationships with these families. And so when families are going through the transition process, it's the first time they've seen the transition process. They don't understand the transition process a lot of times, and they turn to the providers that they've developed a relationship with and say, is this what this is supposed to look like? And ideally, our providers would be able to answer that question and help that family through that process. Because you can imagine anytime you enter a process that you're not familiar with, having somebody that's there that you know, that you trust to help you through that process makes that process go smoother for that family. And that's where Part C has a role in this. So it's not that Part C is just poking its nose in Part B's business. Our responsibility is partially to help families through that process. And so we want those transition agreements in place. We want to help those families that we have that relationship with navigate that process and have the best experiences possible. And that's part of what Part C is doing through that process. And it's not that we're trying to interfere. You know, our providers really do have a responsibility to those families that they've served from 0 to 3. And I know, Lisa, you wanted to say something.
So I'm gonna go ahead and step out of my agency role and my family engagement role and talk about as a parent, because I am also a parent of a child, well, she was born with Chart syndrome. It's a rare syndrome. It's a medically fragile syndrome. It's a leading syndrome, one of the leading syndromes for deaf blindness, because I know Usher syndrome tries to take that. But anyways, we've been through several transitions, and I say several because birth to 3, we were fortunate, we went through TARC since we're here in Topeka, and then we went from Part C to Part B, and went into, we were in 501, so we went to McEachern. We were fortunate enough to have, in my opinion, one of the best special ed teachers in the city, in the state. Unfortunately, she passed away this past summer, but I just want to say that the transition periods that we've had have been successful. And, you know, because of my daughter having a medically fragile syndrome, there's a lot of things involved. She didn't walk until she was 2.5 because she has, her vestibular system is non-functioning. So it's a miracle that she's standing up and walking, basically. But there was 14 people at the table for my daughter's transition from Part C to Part B. Because it was important for somebody from vision to be there, from somebody from school for the deaf to be there, OT, PT, SLP, O&M, and they were all at the table. And Part C led that meeting because they said, you know, they are the ones that knew Madison for 3 years, and I don't have a problem sharing private information because I've been in this medical world for too long. Anyways, and so it was a success. She went into PIP. The PIP, you know, she was in the PIP program. And then we have the transition from PIP to kindergarten. So you have your kindergarten to your 5th, and that was great. From kindergarten to 5th, she had the same team, you know, when I say team, therapist, teacher, things like that. So the scariest transition that we just went through was to middle school. However, talking to the principal, she goes to Jardine. Talking to the principal, they allowed for her to come in when she was in 5th grade to tour the school. She was there with her O&M to navigate the hallways with her cane, just so she could get used to it and familiarize herself with the school. And other families that have children that are also considered deafblind, that's been a complaint that, you know, they don't have that opportunity. And even kids that aren't deafblind to maybe like go up to the next school level and have the opportunity to tour the school, just to kind of familiarize themselves before day 1 of going to like a brand new school where there's like, I don't know, like 300 more students or something. And so, but I just want to say our experience has been great because she's had, and in fact, it's been so great that our TBI actually didn't drop Madison. She went to middle school with her because she likes her so much. And that's Joe Riley, just in case you want to know. But anyways, I just want to say our experience has been great. And I want to echo what Courtney said, that, you know, when there's problems with IEPs or in the schools, the parents in our situation don't have time to have to be like, oh God, do I need to get an IEP attorney involved? Do I need to get families together involved? I'm actually worried whether or not, you know, this upcoming procedure for my child, you know, she has an airway clearance vest because she had issues with her lungs, you know. So, I mean, just remembering those things when we're having these transitions that, you know, sometimes parents might not be as responsive to you because they're also dealing with something else, and it's the medical part of their child. But I just wanted to bring that up. So we had a great experience transition. Next will be high school. I'm assuming that's going to go great as well. We're going to Topeka West, so that should be okay. So, all right. Now I'm back to being in the insurance department.
All right, any other comments in the room or online? Okay, so we are at the point of a little bit ahead of schedule now, but lunch. Before we do that, I have a small request, and I can do it if you just tell me where to go. It is freezing cold in here. If you're not freezing cold, I'm sorry, but I see coats and I have a blanket. So if there's any way we can, I don't know, I feel like the air is on.
We Stacy tried to mess with it, but it was like stuck at 69.5.
All right.
69.5.
Yeah, 60, that's cold. So I don't know who we can talk to, and if we can maybe work on that. Lunch will be until 12:45. If you are on site, lunch is going to be up the walkway here. It's set up, it's ready to go now. We do ask that we eat up in that area. They don't want us to bring food back in here. And we will get started at 12:45 with some more Medicaid conversations. So with that, we will adjourn for lunch.
And Lena, if anyone requested a vegetarian or gluten-free meal, see me.
Okay, if you didn't hear that, if you requested vegetarian or gluten-free meals, please see Joyce.
Stacy, can we just put this on the charger first? Yes.
Even to me, this is the old one, you know, very.
All right, we are at actually 12:48. We are ready to go. I believe we have everybody back online as well. So looking at the agenda, we are ready for Medicaid billing by Heather, and I believe she is online.
I am. Hi. How are you? I am actually Heather Gould, and I am the project director for the school-based services grant. So not exactly Medicaid billing, but sort of. So I'm just going to give a little bit of, just a very little bit information about the school-based grant. I was hired end of October, so I'm still relatively new to this position. I actually came from KSDE. Bert was my wonderful boss and was sad to leave him, but I'm excited for this new this new position that I have. So the school-based grant is a 3-year grant. It started in July, but as we all know, there's a process to getting people hired and et cetera, et cetera. So that started in last year, July 2024, and then it will end in 2027 of June 30th. And the purpose of this grant is to make some necessary updates to the Medicaid state plan and administer with administrative claiming guides. And the proposed expansion will extend Medicaid coverage. It will redesign the state plan amendments and enable broader service coverage. And then what you're probably most interested in is the benefits to the school and students. And the main benefit is strengthening the existing system, equipping schools for proper billing and payment processes, and sustainable service provisions. It also is increasing access to essential services. And that's the main goals of the grant, the school-based services grant. I'm currently working on a stakeholders list that I will be contacting at the end of the week to get getting your feedback, getting some schools' feedback, and also some of the stakeholders' feedback. So that's the next part of this position, this grant. That's kind of a very quick and fast kind of overview. Maybe next month I'll have more of a time to be able to develop a PowerPoint and give more in-depth information about the school-based grant. As you all know, I have a great PowerPoint, but I have to go through many channels to get that approved to be able to present on it and give a presentation. But from that, I will be ready maybe next month. I'm also going to be at the conference in Wichita at the end of this month. So if any of you have any specific questions, maybe you're going to be there, please reach out to me. The whole point is for me to get my boots on the ground and meet all of you and listen to your needs. And if I have any questions, or if you have any questions, please ask me. I'll try to answer. I have a wonderful boss, Bobby, and she'll probably be more the one to answer the questions, but I'm trying really hard to get my head wrapped around Medicaid as a teacher for 19 years. This is a little different for me, and but I'm working really hard and want to be there for the schools. And that's my spill.
Heather, the information that you did share today, I understand, having to go through all the proper channels to be able to have a PowerPoint, but is that information that you did share today available to be shared with us at all?
Unfortunately, no. The grant, we are not able to give you the grant. CMS is very specific about that. We are not able to give that information out.
Hi, this is Bobby. I can kind of help Heather out on that.
Yeah.
Good afternoon. I don't know if many of you know who I am. I'm Bobby Graf Hendrickson. I'm the Deputy Medicaid Director. And maybe I've seen some of you in the building. I've been around for 25 years, and I am quite the advocate for school-based services. I too am a teacher and a licensed master's level social worker. My teaching was done in Southern California, so I'm a little bit of panic mode right now, seeing many of my friends' homes go up in flames. But let's get back to the point at hand. As Heather was saying, CMS has rules around releasing their grant information. The reason why we are not allowed to actually post the grant or the information in the grant is because it does contain personal identifiable information, or PII. And within that information, there are also some security information that identifies persons that CMS will not allow to have posted. I have asked if I redact that information, could I post the grant then? And that request has also been denied. So that is just a part of our federal partners' processes. I apologize for that. We are working on a pamphlet that gives some highlights of the grant, but as Heather stated so eloquently, the main objective of the grant is to assist our school districts in assisting them with the billing processes that has been a challenge for some of our partners. We want to have that opportunity to open up our Medicaid state plan, and we are very hopeful that we can open up our CHIP, excuse me, also our CHIP state plan to offer school-based services to a wider variety of children, and not just those children that are identified on an individualized education plan, or an IEP. That is a major rewrite to the Medicaid state plan, and it will go through many levels of approval processes. As all of you folks know, we are going through a new administration at the federal level. We have been told by the Centers for Medicare and Medicaid Services, any amending of our Medicaid state plan will be coming to a halt, not only for Kansas, but all states and territories. The reason why is because the new administration has the opportunity to appoint their leadership in those positions that will be approving those final documents. The Medicaid state plan is considered a contract between the state and the Centers for Medicare and Medicaid Services. When we are amending the state plan, we will be working with our partners, and those partners are the parents of those children with whom we are all called to serve, those of you on this call, and those persons out in the schools themselves. One of the first things that Heather will be doing is attending the conference in a few weeks. Heather, I'm so sorry, I can't remember the name of that conference. Would you help me with the name of that conference you will be attending?
The SEAC conference in Wichita.
Thank you. Well, golly, yeah, I guess I could have remembered that, couldn't I have? And she will be visiting with you folks, gathering those ideas. You know, the great news is that this is a 3-year grant. And, you know, I'm kind of reminded about that language my mom always used to say, you know, there's always enough time to do something over. So, but let's get it right the first time and not have to do it over a second time. Our Medicaid state plan right now is very restrictive, as many of you on this call know. You cannot bill for any child that is not on Medicaid and does not have those services that are identified in the Medicaid state plan and also identified on an IEP. So we very much—
Bert, can you not hear us?
We're getting closer to the speaker, so go ahead.
Okay.
Oh, yeah, I can also speak louder if that helps. So we do indeed want to do everything that we can to open that up so that that administrative claiming is available for our schools. Because as you know, once you receive that claiming funds, those are your funds as a school district to use as you see fit to serve the needs of those children. I hope that was helpful and answered your questions.
Thank you, Bobby. I do, just looking at the timeline a little bit, you know, it started July of 2024. I blinked and we're in 2025. And so I'm afraid we're gonna be through that first year. We're getting to the point of trying to still, you know, establish the processes and procedures. And now we're also gonna hit a halt at the federal level. So what do you kind of feel like I know what the goals are, what you talked about, but with the change in federal leadership as well as just the process, or do you feel like we're going to get to that point, or going to have to maybe then apply for an additional grant funding to try to make the moves that sound amazing?
That's an excellent question. As you know, hiring in the state takes a long time. Once the state was notified that we received the grant, I posted the position. And it took a long time to hire Heather. Heather, as she stated, was not brought on until the end of October. That wasn't her fault. But now that she is on, she has hit the ground running. We are behind. We are not the only state that is behind. Absolutely, we are. But I am still very encouraged by all the work that Heather has accomplished and her project plan that she has in front of her. We spoke to our project leader at the Centers for Medicare and Medicaid Services this morning. She was also very encouraged by the progress we have made. I know that you cannot see it. The government, both at the state and federal level, folks, is very bureaucratic. I mean, a spade is a spade, right? It's not a shovel, it's a doggone spade. It takes time, but I assure you, we are getting there. And I appreciate your patience. I believe you have Heather's email. And I have the world's longest last name, but Heather will be happy to forward your emails to me. And I am here to assist and help in any way that I can. I hope that answered your question.
Okay, thank you. I think it kind of did. I mean, I think it's keep plugging away, Heather, and you know, hope we don't hit too many roadblocks at any other levels too, because I mean, like you said, we got federal changes coming up and there's a lot of bureaucracy that occurs. So does anybody else have any online or in the room questions or comments before we?
CMS has assured us that we are on, the right track. We're going, we are where everyone else is. We are, everyone is a little behind. And obviously we're all going to have the same difficulties once, administrations change and everything. So know that we're not the only ones. We are also, we might even be ahead of some states. So I know, like Bobby said, like Bobby said, it's just you may not see what's happening, but we are working. I am working, trust me. See the gray hair coming in. But yeah, I'm trying my best. So
I'm sure you are, Heather, and I didn't mean to ask that to indicate that you are or anybody else isn't. I just know
I know
that
it just sounds like we're, oh gosh, we're just, yeah, it's December and we haven't, yeah, I understand. And in your position, I'd feel the same way. Now that I'm on this side, I understand like all of the other moving parts that, happen, unfortunately. So.
Well, it sounds like
located on the 9th floor of the Landon State Office Building. I know many of you are also located in the Landon State Office Building. You are welcome to come up and see me. I am not in the office today, but please reach out to Heather. Again, she knows how to get a hold of me. I'm happy to see any of you at any time, face to face in my office. I am very much a face-to-face person, so please do not hesitate to stop by. Every voice is important to be heard. And thank you so much for inviting us to your meeting today.
And thank you guys for giving us the update that you did provide. I appreciate that. Anybody else before we kind of move on with the agenda? Hearing none. Next up, we are set for a legislative discussion with Frank Harwood. Is he going to, Bert, do you know, is he supposed to be here? Or?
I don't think he's gonna make it because of the board meeting today, which was poor planning on our part as an agency. So one of the things that I do know is that we really haven't received an agenda. We have new leadership in Education, House and Senate. And I don't know that they've come up with their platforms yet of what they want to look at this session. So I don't know that he would have been able to share much. I know that we had an at-risk meeting yesterday where we're talking about the new at-risk legislation that requires agencies to address a cohort of students and follow them over a period of, I believe it's 4 years. And then have to report out whether those students have mastered the curriculum to a level of 70% of them being in a level 3 or a level 4 on the state assessment. So there are 2 groups that have been formed at KSDE to address that. And then that will be shared out with districts. There are 13 cohort districts right now that are participating in the at-risk project. And so they're going to be supporting this work. And we have Jake Steele that will be leading one of the committees. And we also then have Dale Brungart, who's going to work on the fiscal side of that. But that came out of legislation last year. So we have a lot we're still, what shall I say, providing as results of legislation that occurred 3, 2, and last year that have implications for school systems anyway. But we don't know what the priorities are. I think, I hear yesterday, 10 things came out that are going to be addressed this year, but I don't know that they're related to education. Because Christy is no longer on the House Education Committee. Renee Erickson will be leading that, and we're told Dave Thomas will lead the Senate Education Committee because Molly resigned so that she could go to work for PSU and support language and literacy. So we do know we're going to have new leadership this year, and that could be a shining light or it could be a dark cloud. We don't know yet. We'll wait and see what the priorities are for the party since it's a super majority. I'm not letting me answer any more questions other than that. I know that once we have a platform, I know that Stacy will receive it. I know that Wendy is supposed to go over a training over legislative process on Thursday with agency staff at KSDE. So we'll get more information then, but we'll keep SEAC informed and we'll let Stacy know because she attends our meetings and that way she can give you some idea of what might be on the agenda that may impact Bert to 3 services.
Okay, anybody have any questions for Bert? I'm not sure. He'll try though.
Every time I met with legislators, the one thing I found is I think they truly care about kids. They just don't know that systems are delivering what they'd like to see them deliver to meet the needs of kids.
I just had a question. You talked about the at-risk students that are going to be followed, and those are students that are performing below standard, or are they, special education students? Because you talked about level 4 and level 3 and level 4, and I thought that was based more on like the cap in testing and things like that. I mean, I didn't know if there was gonna be any students that utilize the DLM that would be followed.
Probably not, because you have to have at least 10 students that will still be in services 4 years out. So whatever cohort you select, you want to make sure there's 10. What they're going to recommend, I think, is 4th grade. And then they have a chance to look at assessments through 8th grade. So it's the idea that you have a group of students, a cohort of students you can follow, and you have sufficient numbers that you'll have at least 10 remaining that will have data to support the effectiveness of your at-risk program. The whole thing came out of having been a superintendent for 14 and a half years and leading the at-risk program. You as a district decided on what at-risk was defined. And you could put all kinds of things in there, like looks like they're not going to graduate on time, has repeated a grade, was an early 5-year-old that came in very young into 1st grade. I mean, there were so many things. Free and reduced lunch, everybody thinks of that, but that was just one of the characteristics. So what this cohort is they have to select this cohort based upon a determination of what at-risk means in their system. They define it, and they select it. They could select EL students. They could select students that are level 1 on assessments. In other words, they'll decide what they're going to pick as their cohort group, and then they have to ensure that the at-risk funds they're receiving are being spent appropriately so that these students can reach the state proficiency at the 70%, which is level 3 on the state assessments. So I hope I answered your question, but it's just the idea that this is a whole new process that is going to be piloted this year and then will be implemented next year. And if you don't meet the cohort requirements by 2030, then you start to get a reduction in your at-risk funds. Sorry, but that's what it looks like. That's what I heard yesterday anyway when I sat in the meeting. And these two individuals, Jake Steele and Dale Brungart, will then work with these 13 districts to come up with a plan of implementation in the pilot this year to see how it works.
Anyone else have questions or comments in the room or online?
One more, sorry.
No, go ahead.
How are these cohorts decided? Like, is it gonna be across the state, you know, where you have like your rural communities based on the student population and how they're doing? And then also like maybe like an urban community. I mean, I didn't know if it was gonna be like a variety.
It will be a variety because each district gets to decide who their cohort's going to be. In small rural, we talked about that. You may not have 10 students that are in 3rd grade or 4th grade. I had classes of 8 at one point, some was 6. And that's when we had to close elementaries and consolidated the high school building. But it's just an issue of a challenge. So that's why there's been a group of districts selected this year from small and medium and large, so that we can see how that's going to work. Because if you're a large district and let's say you pick EL students that are in 4th grade, you may have 250 of them. What's the odds you'll have at least 10 remaining 4 years from now that you can make a measurement off of in progress? So these are all considerations that will be piloted this year, and we'll keep SEAC informed as this moves forward. But challenges that the legislators have given us, they've given us a few, like dyslexia, where that was introduced in the very last hour and put in a bill that we would have a state disability category of dyslexia. And this is in like June, and I have to get my districts ready to implement that change by August. We did it, but it's just the idea that you never know what they're gonna do and when they're gonna do it.
And Bert, just to talk about that dyslexia piece, you know, we also had to start documenting on our IEPs whether a student was dyslexic or not, or had characteristics of dyslexia or not. Have they asked for any of that data at this point?
No. But they could. And that's what we'll talk about tomorrow. at our SEAC meeting, but for the rest of you, when we define dyslexia, dyslexia is a learning disability with a neurological basis. So we know that the student has difficulty decoding typically. Phonemic awareness, phonics are difficulties. And so what we decided is, since it's already a learning disability under the federal definition and is included in our regulations as a characteristic of learning disability, we just put a checkbox on the IEP so that the agency could say whether the child met dyslexic requirements. And we also told them they didn't have to have a medical diagnosis. Exactly. But a lot of systems were saying, well, I can't diagnose it. It's a medical condition. And we were saying, no, it's an educational issue and you can and you must. And so it's challenged some school psychologists from their training. But at the same time, as far as I know, we're meeting the requirement. If we ever get a request for data, we'll find out how well we met it. That's all I know at this point. Thank you.
All right, thank you. Any other thoughts or comments? Okay, we are ahead of schedule, not completely unusual. We will keep moving though, because who wouldn't like, if you're staying in town tonight for our meeting, a little shopping time or whatever, or ice skate. We've been ice skating for a week. So with that, we are at the portion of the meeting for our ex officio members. I know we have Leslie Gerard here with Families Together, who has a report for both the SICC as well as SEAC. I get to go shopping.
Where do we go shopping?
Yeah.
I'm spending the night, I gotta know.
Okay. Okay, thanks everyone. So Joyce, I think is going to share my PDF. For those here, I'm passing out a copy of the report and Joyce may have already sent it out, but if not, I know she will. But is it okay for me to go ahead and proceed, Joyce?
Just a second here.
Sure.
Well, of course it wants to be difficult.
I think I can start talking.
Yeah, go ahead.
Most of you have seen this before, so what this is looking at is, what Families Together has been doing over the last quarter. So this is for October through December. And the first pie chart, if you will, it really focuses on the individualized assistance that we provide to families as well as training. The 3,100 individualized consultations and training is equivalent to over a 30% increase from the prior quarter, which is really not surprising considering we have July and August in there, but I am interested to see what it does this next quarter. Again, I'm sorry for repeating myself, but in case there are new people, to kind of explain the pie chart a little bit, we have our parent assistance that we provide in a tiered system. So when you see tier 1, tier 2, tier 3, that just represents kind of the intensity of the support that we're providing, with tier 3 being the most intense. And then when you see IEP MP, that stands for IEP Mentor Project. And that is when we actually would be attending an IEP meeting, either in person or virtually. And so leading up to that, we would have done quite a bit of work with the families, including some person-centered planning using the Charting the Life Course framework to help them get ready for that IEP meeting, and also working with the teams as well. So, providing them with information that the family wants to share. I will just kind of give you a little commercial about something we're excited to be getting going. We hope in this coming year is working with some students to prepare for their transition age students, to prepare for their
high school years, if you will, and beyond by doing what we're going to call an IE podcast. So we're going to be working with kids across the state to where they can provide input for their own meetings and their, you know, dreams for the future and what they see that they need. And so we're excited about being able to do that. We've got some great partners that we hope we're going to be doing that with. We'll be doing it on a small scale for sure. And if we get some funding that we've applied for on a larger scale. So stay tuned for kind of seeing that within this pie chart as well. Some other things to note on the data. The ethnicity breakdown really didn't change a lot. We had some increases in a couple of areas, but it was really the decrease in the not determined area, I think, that led to that. We're trying to dig in and get some of our data cleaned up. The ages didn't change a lot either. Well, actually, we did have a big jump in the 6 to 13. And where we saw those decreases was in the 14 to 18, and then also just a slight decrease, 1% in the 3 to 5 age range as compared again to the previous. And when we compared, I believe that last report was for the 6-month period. So it's kind of looking at compared to that last 6 months. The disabilities, primary disabilities served doesn't change a lot. Over half of them had increases, which, you know, makes sense since we had more numbers. On the flip side, you know, looking at the top 20 reasons people are engaging with us, we had some newcomers to our top 20. So again, that usually stays pretty consistent, but we had one thing we had really jumped in there was our CHASE program. So that's our communities honoring students' success in education. And that's really looking at, it's as low as age 10, but kind of that 13 to 21, and now with the new grant up to 24 age range. So really focusing in on working one-on-one with students and taking them through an 8-week program that we have. So I'm going to go back and investigate this a little bit myself, because I'm not sure why that jumped up so much. If it's, you know, a lot of outreach that we're doing because of a new grant that we have with Department of Commerce, where we are really trying to focus on that CHASE program and get the word out. That's going to very much help us expand to all of Kansas. The pilot project with the Department of Commerce is happening right now in Garden City, but it will then go into statewide. And so we're super excited about that. So we'll be adding some more people to work on that project. Let me see what else is interesting on this one. School issues I hope to get rid of, because I know that doesn't tell you anything. So we're still working on cleaning up stuff. And unfortunately that one jumped in there and must have increased. So again, working with staff to really maybe better identify what exactly we mean by that. You know, it's right there in front of you. So if you have questions, let me know. Sorry, I guess it's not necessarily. I think people got this mailed to them, emailed to them.
Yes, and it's on the YouTube live. For some reason, I can't get it.
Awesome, no worries at all. Down below, the education advocate numbers, again, continues to be very, very busy. You know, we had new appointments, cancellations, and then just to remind you, the asterisk just means that's a brand new child into the system at whatever level that's at. And then the final means that they're out of the system, either adopted or aged out or no longer receiving services. We are going to have a little change, and I haven't even been able to tell you this, Brian, but we are having some staff changes. So Lori will be moving into working on another grant that we have. She's been on the Education Advocate program for about 3 years. So we'll have an opening there. So we'll be filling that as quickly as we can, because that is, again, a very busy project. And then it looks like the CHASE program, the highlight is the superhero pose. So I encourage you, when you get that, to go to that link and you'll see Jordan. She's one of the persons on our CHASE team, and Natalie. They've done a fun activity that they use in the CHASE program. So you guys will be able to experience that a little bit. Any questions for me? Well, thank you, Leslie. Thank you. And since I have the mic, I'm just going to thank all of you, because just so much great stuff, and really appreciate the collaboration and the meeting with folks and being kept in the loop. It really is helpful for us. So thank you for all the work you do.
And I'm just going to say, since I have a mic, that, and I think we mentioned it before, but I can't thank you for the relationship that has been developed now from the field with Families Together. I mean, when I first started, it was, if we heard that name, we were like, oh, you know, Mufasa, right? Like, and now it's okay, like, let's talk, you know? And so I really appreciate that as we're working together, literally. Next up, we have Casey with Ashley Inns.
Hi, I almost said good morning. That shows where I am right now. I think we're working on pulling up the update, and if not, then we can certainly send it out to you guys. Just a few things. Let me pull it up so that I know what I'm saying. So my name's Ashley Enns. I'm the liaison for Casey to SEAC, and so the role that I play is on the ex officio side, just really bringing back some information to Casey, and then also bringing any relevant information in addition to the directors that are serving on SEAC as well. This year, or this quarter, a couple updates. Last time I talked a little bit about our awards and scholarships. Those have concluded, those nominations have concluded. And so the recipients will be announced at our winter conference, which is in January, January 30th and 31st. Great. And I think I noticed a couple typos when after I sent this to you, so I'll send you the updated version, you know, the one that says January 2025 instead of November 2024. Sorry about that. The new year always gets me, right? But our awards and scholarships have concluded, and so we'll be announcing those January 30th and 31st is our conference. Registration's now open, and we're excited to have that conference opportunity. And I think a lot of people have started to really look forward to the membership meetings. They've been led with a lot of really good information and also connecting people. One big thing that we've talked about this year is the connecting with Casey. That started last year, but has continued this year. And the value that as a field, we feel like we're getting from this is huge. So feedback both to our Casey president, Lena, who's on the SEAC as well, but also just in general, this is a wonderful opportunity for our administrators to connect with each other around topics that are important for them and have a free conversation about what challenges might be presenting when they're going through some of these things. So our most recent one was on a very cold, snowy day, but many joined in with Carrie Rogers talking about text-to-speech accommodations and how to document those on the IEP. With some of the changes in the state assessment, there's different ways that we're needing to change those IEPs so that it's accurately reflecting what the students' accommodations are. Back in November, Alina Lincoln went through some of the, her phrase is always the what, so what, now what, about our Tri-State Law Conference. And then back in September, which feels eons ago, we talked a little bit about licensure with waivers, subs and vacancies and things along those lines. So again, that's something that started last year. It has been a really, really valuable contribution to the whole group at Casey. I included a couple resources that Lena also provides to us through her monthly updates. One new thing I added to this update was a link to Lena, Dr. Kisner's updates that she sends monthly in case there's valuable information that you guys would like to see on those as well. I think that is all that I have as an update. You're welcome to click around on the links once you receive this and reach out with any questions to me or to any of our Casey leaders. And Lena, I will open it up if you have any other announcements.
I don't have anything else. Thanks, Ashley.
Thanks.
All right, thank you, Ashley. Next we have Disability Rights Center, Mike. I know he wasn't on earlier, but has he been able to jump on since?
I do not see him on here.
Okay, thank you. And Melanie Haas is at the state board meeting, so she's not available from the Kansas Board of Education. So next we have the Kansas State School for the Blind with John Harding.
Just a couple of dates that we have coming up I want you to be aware of. Our Celebrate Access Braille and Beyond event will be January 30th at our school. And then we do one in Wichita, February 6th. It's a lot of fun. There's Braille competition for kids who are blind and low vision from across the state. Our Advocacy Day at the Capitol is a chance for our kids to practice advocacy, and that'll be February 20th. We don't do the booth in the rotunda. We like our kids wandering about, knocking on doors, knocking over statues sometimes, but but they know we're there. We thank them, of course, for their support, and then we're partnering with the National Federation of the Blind, the Kansas chapter this year, just to teach our kids about how the system works and how they can advocate. March 25th, we're hosting the SPED Leaders Forum. This is a Greenbush sponsored event. Rebecca Helget heads that up, and we're excited to host a group of SPED leaders. I think they're going down to KSDE in the afternoon. Summer school in June, we've gotten so busy, we've had to stretch that to 4 weeks in June. And then we also do ESY on the road, because we know it's hard for kids to get to our campus from places far away. So very popular and growing. The last two things I want to mention is our FIT program, our Family Infant Toddler program, serving over 200 kids in partnership with infant toddler programs across the state. So we're excited about that. Narita, who's here today, heads up that group. And then lastly, we have some mobile STEM unit and a mobile blind sports unit. These are really for regular ed kids to learn about accessibility. We have a lot of fun with those. They're completely free. So if anybody's interested in having a fun day for their teachers or kids, let me know. Thanks for letting me give an update.
Any questions for John? If you haven't been to the state school, it is quite the gift you give yourself. If you go up and visit, SEAC did that, and wow, we were all so impressed with both
We get
states.
some free coffee too, Bert.
That's right. And we got a mug.
You might have paid for it. I don't.
John, I was just writing down dates, and the one I wasn't writing fast enough on the Greenbush Sped Leadership Forum.
March 25th.
Thank you.
Morning at School for the Blind, and then School for the Deaf is hosting in the afternoon, I think. So maybe Jennifer, if you confirm that.
Okay, thank you. Which does bring us to the Kansas State School for the Deaf. I don't believe Luann was on. I'm not. Maybe
She was
he is.
on earlier, but.
Okay.
And
She is
Jennifer
on.
suggested that Luann might speak
Yes,
more.
this is Luann. Can you hear the interpreter?
Yes, we can. Thank you.
Okay, great. Good afternoon. This is Luann. Good afternoon from Kansas School for the Deaf. I am Luann Barron, the superintendent here at KSD. I know there's some people that might know familiar with the School for the Deaf, but hopefully we can learn to know each other. So I'm going to explain a little bit about the background of the school. Kansas School for the Deaf is located in Olathe, Kansas. We're currently serving 150 students, both deaf and hard of hearing, ages 3 through 21. Also, we provide early intervention services to 184 infant toddlers all over the state. It's the coordinator of early intervention for the state. KSD provides bilingual ASL and English education to make sure that students develop fluency in both languages. The school also provides outreach services across 62 counties in Kansas, totaling 795 services, benefiting students and families statewide, students who are deaf and hard of hearing and their families. We want you to know that KSD is a fully accredited school by the Kansas Department of Education. That's KDE, and also CEASD, Conference of Educational Administrators for Schools and Programs for the Deaf. The goal is to provide full access to both languages and ensure that deaf and hard of hearing students achieve academic success comparable with their hearing peers. Success is not only about academic achievement, but also about personal growth, including emotional intelligence, resilience, leadership, and social development. We strongly encourage participation in extracurricular activities, supporting well-being, and also preparing students for future careers to help them reach their full potential in all aspects of their life.
I wanted to talk a little bit about our program, our outreach program called Sound Start. And many of you might have heard of this. Know that Sound Start is a comprehensive early intervention program for children aged birth to 3 who are deaf and hard of hearing. We work in close collaboration with Sound Beginnings, the program that is responsible for the newborn hearing screenings. And we also work with Kansas Early Childhood Development Services to identify and provide support to families of infants and toddlers who are deaf and hard of hearing. Sound Start partners with early childhood development services all across the state to deliver services, quality services that are tailored specifically to deaf and hard of hearing children, with an emphasis on language acquisition. Our demand for our services has grown significantly by so much in the past 2 years, reflecting our expanding reach and our expanding impact. For example, in 2023, 147 infants and toddlers were served, with a total of 939 home visits. In 2024, it increased to 184 children, infants and toddlers, with a total of 1,282 home visits. So that was a very large increase. KSD currently is actively collaborating with Kansas Department of Health and Environment, KDHE, to advocate for increased legislative support and resources to expand services for children age 0 to 3. However, despite the program's growth, the current staffing capacity of both the Sound Start program and the Deaf Mentor program limits our ability to provide the frequency and the intensity of services that remain so crucial to meet the needs of the families requesting our support. Increased support and funding are vital to ensuring that each family has access to the resources they need for their child's development. That is an area that we really are trying to emphasize, the expansion and the number of infants and toddlers that we are able to serve and who can provide services receive services through our program. The last thing that I want to mention that some of you maybe already have known and some maybe not, our language assessment program, we call it LAP, for the deaf and hard of hearing kids, is a state mandated initiative that provides and conducts language assessments for children ages birth through 8 to also monitor progress in achieving key language milestones in ASL, American Sign Language, and/or English. Those assessments are an essential tool for tracking early language development and ensuring that young children have access to language skills that are necessary for their academic and also social success. As many of you probably know, KSD is responsible for administering these assessments and also maintaining accurate records of the data. Every year, the results are compiled and presented to the state legislature, providing valuable insights to the language development of children in the deaf and hard of hearing community. The program plays a key role in shaping policy, supporting services for young deaf and hard of hearing children all across the state. The annual report of language assessment program for the deaf and hard of hearing in fiscal year 2024 will be submitted to the Senate Education and House K-12 Education Committee by the end of this month. So if you are curious and you'd like to see the annual report, it will be posted and published at kcdhh.ks.gov. So also I did want to share that, as Joyce said earlier, that I have brochure with information regarding our programs, KSD services that we provide, and for our students who are coming to campus from all over the state. And I can send a link to that through the chat so that you can share it with your communities as well. So that's, John, you mentioned before that there was a special ed conference or forum to visit both schools. That's on March 25th. I am very excited and looking forward to that visit here at KSD so they can see our students in action and get a better picture of how both schools are set up and they serve such special populations for the deaf and hard of hearing and also blind and low vision. Open for questions if you have any questions.
Thank you, Luann, very much for all that information. Appreciate it. The next one on the list is KNEA with Idelia Schumann, but she is unavailable to be here today, so we will not have that one. I did want to make a couple of announcements. I'm not sure if you guys have any other red tape things you need to work on as well, but the next SICC meeting, which I really want to just say SIC meeting, but like it's a really cool meeting. It's SIC. Is February 21st. SEAC members, we actually have another meeting tomorrow. It is at the Landon State Office Building. We will have breakfast with the State Board of Education at 8 a.m. So you will be able to get in about 7, or SIC are welcome to come to that breakfast too. You'll be able to get in about 7:45. We'll have breakfast about 8 to roughly 9, and then SEAC, we will go ahead and start our meeting at 9. With that, are there any other announcements or final wrap-up things? Seeing and hearing none, then we will adjourn for the day. Thank you, everyone, for being here.
So now we can go shopping.
You're not shopping on my dollar.
No, I know that. I just don't know where to go. I just need to follow you.
I don't have money.
I know people really say things like that. I'm just saying. Well, maybe we did. We're getting reached out.
That's